Welcome to Career Insights. The Career Insights series features local industry professionals engaged in conversation with students and recent graduates about career planning and job opportunities in Polk County, Florida.
My name is Laura Webster. I am an academy coach at the Polk County Public Schools Workforce Education District office, and I am joined by my colleague Tamara Fields. Tamara, do you want to introduce yourself?
My name is Tamara Fields. I'm also a district academy coach, and Laura and I will be on all throughout the call. We'll be kind of tag teaming and doing introductions between each speaker. So thank you all for coming today, and I'm excited to see what we have to offer here.
My name is Kevin Ferrier, Program Director of Cardiovascular Technology here at Polk State College, Airside West. Like the other programs, I am going to talk to you for a couple minutes, and then I'm going to take you into the lab and show you what our students are doing. We actually have students in the lab today. So cardiovascular technology, the program is a 2-year program. It is a limited admission program. So just like the other health sciences, we have prereqs to get into the program. It is very important from the start that you guys do as well as you can to get into this program or any other health science programs. These programs are competitive to get in and requires good grades. So stay focused in science, stay focused in math, and you have a good shot at getting into these programs. So many of you probably don't know what cardiovascular tech is all about. We specifically train students to work in the cardiac cath lab next to the cardiologist. So you guys have all heard in the health science programs here in the high schools, you've all heard about myocardial infarctions and heart attacks and cardiac arrest. Well, when that happens, there's ways of treating patients, and cardiovascular techs help cardiologists deploy balloons and stents and find blockages in the heart and then fix them. So it's a really, really cool job to be in, for lack of better words. It is a very competitive program, as I said. The prerequisites to get into our program are English Comp, college algebra, or liberal arts math. I think it's called Topics in Math now. Human Anatomy and Physiology 1 and 2, and then, of course, medical terminology. So those are the prereqs. We have an application process. Our application is due June 30th of each year, and we only admit between 13 and 15 students once a year. So the way our program is set up, all the didactic courses and all the hands-on lab are done in the first year in your program. Then in the second year of the program, you go out to all the clinic sites and work with real doctors, real nurses, real techs with real patients. Our second year has you in the clinical arena 32 hours a week. So it's like having a full-time job, but that's where you gain your experience and are exposed to a plethora of different scenarios. So one thing that students want to know is how much does the program cost? Program costs about $11,000 for the 2-year program. That's the tuition set by the Florida Department of Education. So it's a relatively inexpensive program to go through. Then the follow-up question that every student asks, they say, how much money can you make? Well, cardiovascular techs start out between $52,000 and $56,000 a year. So that's just the base salary. In the cath lab, we never know when people are going to have heart attacks, so you have to be on call. So if you take call, it is not out of the realm of possibility to make between $75,000 and $80,000 a year as a cardiovascular tech with a 2-year degree. The really cool thing about our field is heart disease is the #1 killer of men and women in the United States. So that translates in job opportunities. We have 100% job placement for our students that graduate from our program. Now, when I say job placement, I don't mean we put you in a job, but we have such an extensive clinical experience with so many different clinical partners that students are prepared and they get jobs upon graduation. For example, our next class graduates in August, and I have 3 students that already have jobs. So as a very field that's wide open, it's very well paying, and it's a very cool field to be in. What you're going to see in the lab, I have students doing heart caths on a mannequin. I have students that have we have a simulator called the Symbionic Simulator. It allows the students to actually inject X-ray dye in real time and actually fix the arteries. So we'll be able to see that. We'll talk a little bit about it, and then I'll answer questions at the end. But it's a very competitive program. I don't know if I said we accept 13 to 15 students a year. So if you have questions, you can wait to the end, or you can go to www.polk.edu/CVT. All right. Cardiovascular technology, CVT. Okay. So that's www.polk.edu/CVT. And there's a plethora of information that you guys can navigate through there. So here we are in the cath lab. Okay. We have our own cath lab. We actually teach students how to prepare patients for the lab. Okay. We have mannequins that we work on. It's kind of dark in this area. You can't see this very well. We learn how to defibrillate. We learn how to give medical drugs and how to help or assist the cardiologist during procedures. So I'm going to turn around here, and we actually have two students working. This is our C-arm. This is what takes, you might not be able to see that very well. This is what takes the X-ray images. So students will actually assist the cardiologist, okay? So these two students are learning how to assist the doctor. One is playing the cardiologist and one is playing the student. And they are actually inserting catheters. I don't think you guys can see that, but they're inserting catheters and wires into the heart arteries. And what they do is they then take pictures of the heart arteries and find blockages. And then it's our job as cardiovascular techs to assist the cardiologist in fixing the blockages that we find. That can be done by angioplasty, by stenting. It can be done by removing plaque or removing blood clot from the arteries. Just going to give you guys a different perspective of what they're doing here. Okay. So they're pretty active. We are really physician style assistants, but we don't get paid the money a physician's assistant gets paid. But nevertheless, it is interactive. And believe it or not, the cardiologists actually rely on their cardiovascular techs and their nurses in the room for assistance and help on actually what to do with the patient at times. So it's very interactive. Our students are also given sterile supplies like the trays that we use. Okay, it's just a different perspective of what they're doing. This is an actual heart cath. So they get real supplies to take home and practice with and hone their skills. Okay, very cool profession to be in. All right, so I'm gonna walk over and show you guys one more simulator. I have two students here working on what we call our Symbionic Simulator. Now, I don't know how well you guys are going to be able to see this screen here, but these students are taking what the other students were doing a step further. Let me see if I can, I don't mean to put you off here, Tennessee, but you can actually see the actual X-ray dye that they actually, again, I'm not a videographer, X-ray dye they inject in order to find the blockages in the heart. So, and Jimmy's actually pointing to where one of the blockages is. And once they identify that blockage, they are then learning how to actually do angioplasty and stenting. With this simulator, it is very cool because the students actually can see the live X-ray images without being exposed to X-ray, and they actually have to play the part of the doctor and fix the blockages. So it's really, really cool. For a lack of better coolness, they can actually kill the patient if they do not do this job correctly. So this is a serious profession. We save lives on a daily basis, and it is highly interactive with the physician. So, but this simulator that we have is very, very, very useful for students. They use real wires and catheters. Okay, here's a picture of wires and catheters, and they actually put that in the simulator and find the blockages. So that's kind of it in a nutshell for cardiovascular. At the end, we don't have a chance to answer your question. If we run out of time, all I'll ask you guys is to go to that website, www.polk.edu/CVT. My email address, my contact information is there. I am happy to speak to students at any time. And I certainly hope that we eventually get to see you guys back in airside in our labs, because it's a lot cooler to see this stuff face to face. But I thank you guys for your attention, and I look forward to speaking to you guys. You guys have a great day and good luck with your studies. Hope to see you guys in the program.
Our next presenter is from respiratory.
Good morning. I'm Shana Kent-Smith. I am the program director for respiratory care. We're going to shift gears just a little bit. I have a PowerPoint presentation, and then I want to take you into a tour into our lab. Again, I am Shana Kent-Smith. I am the respiratory care program director, and I believe that respiratory therapists are real life heroes. Now, a few years ago, several people heard of the phrase, if you can't breathe, nothing else matters. And that's why I think respiratory therapists are real life heroes. The question may be, so what actually do you do? I teach people how to help other people to breathe. And how we do that is that we do have an active lab that you will see shortly. And we have classes. And then we also, like the other programs, we go into the hospital to demonstrate our skills to help save lives. What is a respiratory therapist? Just because of the recent pandemic, more attention has been brought to respiratory care than ever before. We help anyone that has difficulty breathing. So that can be just as simple as putting on a nasal cannula, an oxygen source for your nose, or as complicated as more aggressive therapy that's in the hospital. So where do we actually work? We do work in the hospitals, as you can see at the far screen, and that's when people are unable to breathe and we help assist them to breathe. Or we can be a part of a flight team where we transport neonates or adults to a higher acuity hospital to assure that they are breathing adequately and ventilating adequately till they reach the hospital. And then we also work in pulmonary function labs, as you can see in the bottom screen, where we have measure the capabilities of individual lungs. We also work in the rehab centers to help build the lungs back up after a traumatic experience. We also work, as you can see in the bottom picture, in the neonatal ICU. So sometimes babies have difficult breathing in the beginning of life. So we help assist them to breathe until their body catches up with their lungs. We also work in the community as in home health care, sometimes nursing facilities, sometimes doctor's office. So it's a vast area to which you can do respiratory care. So everyone wants to know, I know I did, if I go to school, will I have a job afterwards? The growth of respiratory is just phenomenal. The job outlook is that in the next 10 years, it's projected to increase about 19%. So what does that actually mean? I'm just going to give you an example. One of our local hospitals, Lakeland Regional Hospital, everyone has seen the expansion at Lakeland Regional. And with that expansion, because it is the trauma center in this area, they need more respiratory therapists. Also, let's look at Winter Haven Hospital. If you drive by Winter Haven, you notice their expansion of their cath lab for Kevin, also their new medical surgical ICU. They've had more patients room. So what does that mean? That means that you will get a job after you complete your coursework, complete your clinicals, and pass the national board examination. So what is the steps to becoming a respiratory therapist? Well, our application period, you have to apply to Polk State College first, because that is a different application than applying to the program. So respiratory care, you can complete an online application that's available during once a year from April 1st to May 15th. When you're considering the phenomenal position as respiratory care or as a career choice, you must understand a few things. There are prerequisites to get into the program. You have to make sure before you apply that you have completed English Composition 1, College Algebra or higher, and Anatomy and Physiology 1 at the minimum. At the minimum, you have to have a 2.0 cumulative average with C or better in these courses. I must emphasize, just like our other healthcare programs, we are a limited access program. So we're only allowed 24 students a year. So it's very competitive. Just like my other colleagues mentioned, be sure that you do very well in your math and sciences and focus on the information you learn because it will carry over into the next semester. We also encourage students to start their program required courses such as Anatomy 2, Micro, General Chemistry, Psychology, and Ethics, because if you go ahead and take those courses, then you can just focus on respiratory courses when you're accepted into the program. Now, if you're accepted to the program, be mindful that you will have to have immunization requirements and fingerprinting, background checks, and drug screens. And Dr. Connor earlier spoke about how it's important to keep a clean background, especially if you're going into the healthcare field. So again, respiratory care is an AS degree program. It's a full-time commitment for about 5 semesters. We train you in the classroom first, and then we take you into our lab, and then you have clinical training. And after all this commitment, and it is a full-time commitment, you'll be like these individuals here who's smiling because they finished the program, and all of these individuals have jobs. So for the past 5 years, our program definitely has had 100% higher rate or job placement. Okay, so this is our respiratory care lab. So I'm just going to switch the screen just so you can see our active students working in the lab. It's so important in respiratory care. Do you have a teamwork concept? So you will frequently see our students working in teams. We also have a few of our clinical instructors here actually in the lab helping our students. So this station, she's working on mechanical ventilation. And then we're going to just continue to walk, because as many of our labs, we have simulators that we do case scenarios to help prepare you for the real life settings. Also, again, in the next section, we have another clinical instructor, and she's helping our students with mechanical ventilation. Because again, I said before that if you can't breathe, nothing else really matters. So mechanical ventilation is essential when it comes to respiratory care. And now that you can see our lab fully, you see there's plenty of areas to study. There's plenty of areas for you to work with other students. Let's see. Do I have a volunteer that will talk to one of our students about respiratory care? Okay. So we're going to come over to this young lady. Yeah, I think they can see you.
Hi, I'm Shaladra. I'm the class president of the Polk State Respiratory Care Program, class of 2022. This is a great program to be in. We get a lot of hands-on experience inside of the classroom, as well as now that we're out in the clinical world. So if you're interested, you can definitely come to Polk State Respiratory.
Thank you. And let me go over here to one other area, and I'm gonna have to stand back. As you can see, our clinical instructor helping them with mechanical ventilation. So again, this is the profession of respiratory care. And as my sign says right here, we definitely save lives, and that is the focus of our profession. If you have any questions about respiratory care, please do not hesitate to call me. You can go to our website, which is www.polk.edu/respiratory care as one word. So please, again, do not hesitate to call me. Do not hesitate for any questions, because it's important. We're at a national shortage of respiratory therapists, so we will enjoy speaking to you. As you can see, our students will talk to you to give you the what's up in respiratory care. So thank you very much for your time.